Dan Huckins here from Danbury Senior Living. Virtually all of us have a story during this pandemic of how it's affected our lives. I think it's put a fairly deep mark on all of us, but probably none more than our senior citizens. For those who are part of Danbury Senior Living and senior living organizations and buildings across the country, they've stayed for months inside the building or even inside their apartments, homebound, and unable to receive visitors. So it's hard to know what happens inside these buildings. Well, allow me to give you a glimpse inside.
I tried assisted living and I fell in love with it. I have the chance to be a nurse and the chance to get to know my residents and listen to all the amazing stories that they have to tell.
I've been in senior living honestly since my very first job as a server in the dining room at a retirement community. And really, I've been fortunate to have so many opportunities to move from dining to sales director, and now be working for a great company like Danbury.
If you've been around COVID, it's scary and you know how serious it is, but if you haven't, it's easy to not think it's that big of a deal. There's a lot of people, like family members, who are frustrated. They can't see their loved ones. I mean, everything really has changed. The way that you live life, the way that you go day to day, the way that we, our plans for school for our kids. So there's been a lot of changes and adapting along the way.
We don't really go out and about and do things. I try to go to the store once a week, and we keep, those kinds of things to a minimum. The hand washing, all that fun stuff, masks, that kind of thing. We didn't really do things over this. Obviously things were shut down, but your typical summer activities didn't get done because it's just too much of a risk. I don't want to bring it into my residence.
While Danbury remains a vibrant community, there have been many changes for our staff. They've made major sacrifices. Some of them stayed in their community in a room that we provided for them, away from their families, sometimes even for weeks. And we know they experience real fear and anxiety. Some of them have altered their lives outside of the community so that they don't bring the virus in based on what exposure they have when they're away from us. They have concerns. They have concerns about their own health. They have concerns about their family's health. They have deep concern about the residents' health. And yet, they keep fighting.
I got a call on one of my days off, and April and Chris asked if I would be willing to serve on the COVID team. And my initial gut response was just yes. I chose to stay here and not go home because I didn't want to put my family at risk. Our whole profession is rolling with the punches and adapting and doing what's best for the people that we're caring for. I just have to be the best nurse that I can be and take care of myself so that I can be there for the people that I want to be. And if this is what I have to do to take care of the people that I'm here to take care of, then I'm willing to do that.
A lot of stuff has come with isolation, when we have a resident go out, there's a lot more steps we have to take to protect ourselves as well as the other residents here in our facility by putting on gowns, face shields, stuff like that.
We have one point of entry into the building, and everybody who comes into the building has got to be screened. We take our temperature every morning on the way in and then on the way out. Any kind of cough, cold symptoms, any not feeling well whatsoever, we're not to come into work. We definitely we still try and maintain somewhat of a social distancing. We all have to wear, caregivers and the nurses have to wear the N95 masks.
Governor DeWine said it best early on. He said the best defense against this is to keep it out at all costs. So they tell us every day it's hard to not get with their families, but they're not going to push it. They're not going to ask us to bend any rules. In fact, we go above and beyond some of the rules and guidelines set by the state.
We've been extremely fortunate here at Danbury Hudson. I feel like our home office has been really supportive with testing for us to have a lot of peace of mind of what's going on with getting testing early, with our staff getting tested every other week, with residents that may have symptoms getting tested and alleviating some of our worst fears.
I'm not only there for my resident physically, I'm there mentally. I'm sometimes their only interaction in that day, person to person. So that takes a lot of toll on me as a person, but that's what I love to do. And I just see them as if it were my grandparent, how would they want to be treated? How would they wouldn't want some random person coming in and taking care of them. They would want someone they knew.
I really am so proud that they trust us, and I'm proud of what our staff has done in delivering on that. And these family members know that they are safer at Danbury, that they're more enriched at Danbury than they were previously.
Yes. Our staff has stepped up in so many ways. One of the big ways that they have stepped up is in moving in our new residents. Meeting the moving truck outside the building, unloading all their belongings, moving it into the apartments, placing it in just the places that the resident would like it to be, so that when they actually move into the apartment, it becomes home for them much more quickly. This is a role that for the most part has been played by families and other loved ones, but during these precautions of COVID, our staff members have stepped in and did that for them.
It is all hands on deck. We are all helping each other, hanging pictures on walls to putting together if someone gets a new bed or a new dresser, we're the ones assembling it, and just all hands on deck doing what we need to do every day.
I became a nurse for a reason, and this is why. To take care of people in scary situations like this, and just to do what little I can to help.
I hope that one day this is going to be right behind us, that we're going to have families back in here. My residents are going to see their sons, their daughters again, see their great-grandkids.
I can honestly say I'm happiest working in this field than I have ever been, especially the memory care.
The core of what I do is still the same. The surroundings are a little bit different, the environment's different, the things that the residents go through are different. It's hard, but it's worth it to keep them safe.
Danbury Senior Living is built upon this mission to create vibrant, caring, exceptional communities for our seniors. And guided by this principle, always do the right thing for the residents.